Welcome everyone. So now we are going to look at heart sounds, and the first heart sound is S1, second heart sound is S2, third heart sound is also known as Airtel click, and fourth heart sound is heard when there is any abnormality. So in this way, first heart sound is produced and it is known as S1 when there is mitral valve closure. Now this is right side of the heart and this is left side of the heart. Okay, so as you know, this is right side of the heart and this is left side of the heart. From right side there is tricuspid valve and left side there is mitral valve. So when mitral valve is closed, first heart sound is produced, and uh, on closure of mitral valve there is first heart sound, and second heart sound is produced when there is aortic valve closure. Aortic valve close results into second heart sound, and when pulmonary valve close occurs when pulmonary valve close at the end of systole, and additional heart sound is third heart sound. Third heart sound is additional heart sound, or it is also known as Kentucky sound, and its example is like when heart failure occurs or volume overload results into third heart sound, and the last one is fourth heart sound, is also known as tennis, occurs in late diastolic atrial contraction when there is hypertension or hypertrophic cardiomyopathy. So in this way, heart sounds are heard. Others are the murmurs, like there are systolic murmur between S1 and S2 indicating turbulent blood flow during ventricular contraction. Diastolic heart sound are produced in aortic regurgitation. So in this way, heart sounds are produced. Four types of